Hi, this is Dr. Christy DeSapri, founding physician of Bone and Body Women's Health. Today I want to talk about urge incontinence, which actually affects about 40% of perimenopausal women. And this is defined as an involuntary loss of urine. It also can be symptoms of overactive bladder. So things like frequent trips to the bathroom, getting up multiple times a night, inability to hold your urine. And this is one of the subtle signs of perimenopause and really is due to declining estrogen that affects both the decline in the pelvic tone or the pelvic floor muscles that support the bladder and the urethra, but also it's due to declining estrogen that decreases the tissues and the sensitivity of estrogen in the tissues like around the urethra, the vulva, the vagina, all of these things. And so oftentimes women come to me thinking, I never used to get up in the middle of the night. Now I have to get up more often. I need to go to the bathroom every 1 or 2 hours. Obviously, if this isn't accompanied by pain, we don't think this is a urinary tract infection, but sometimes, again, women are more sensitive to this in the perimenopause and the menopause transition. We often do a fluid intake or a fluid diary to talk about things like bladder irritants like caffeine, alcohol, sparkling water, just the amount of fluid that you're drinking that can obviously impact how many trips you make to the bathroom. But also we talk a lot about things like Kegel tone or pelvic tone and doing a good gynecologic exam to evaluate the muscles of the vagina and the tissue of the urethra, the vagina, the vulva, because all of these things really contribute, again, to declining estrogen and maybe subtle signs in the perimenopause that urge incontinence could be due to these hormonal fluctuations. A lot of things for treatment here, obviously recognition of the symptoms and the contributing factors, taking a good trip to a pelvic floor physical therapist to help you learn how to do an appropriate Kegel or understand that brain-bladder connection. Vaginal estrogen or vaginal hormones, even for women in the perimenopause, can be very effective. And then we also obviously have medications to treat urge incontinence and specialists like urogynecologists that we rely on too for more patients who are in the complicated realm. Or who might benefit from surgery. So lots of options. This again is sort of often an overlooked symptom of the perimenopause, but lots that we can do to help ameliorate those frequent trips to the bathroom and prevent getting up at night to pee more often, get a better restful sleep, feel better the next day. I hope to see you soon.